Hello guys, welcome back. Now let's discuss about meningitis. Now you know it, in the name itself it's there. Meningitis is the inflammation of meninges. Inflammation of leptomeninges. So the meninges are getting inflamed. Now why they are getting inflamed? Why? Most commonly because of infection. Because of infection. Okay. Which infection? Bacterial, viral or fungal? It can be anything. Okay. So what is the most common cause? What is the most common organism causing meningitis? Say in neonates, let's put it this way, neonates. In neonates, the cause of meningitis is E. coli. Okay, E. coli, gas group A beta hemolytic streptococci. Okay, group A beta hemolytic streptococci, E. coli, and one more organism which is called as a Listeria. Listeria monocytogenes. Okay, so these are the causes. So in neonates, it's the E. coli, group A beta hemolytic streptococci and Listeria monocytogenes. And in children and teenagers, okay, after neonates, now children. Now in this age group, the organism is Neisseria. Okay, Neisseria meningitidis. So in the name itself it's there, say meningitidis. It's going to affect the meninges. Next, the Streptococcus pneumoniae is the most common organism. Streptococcus pneumoniae is the most common organism causing infection in adults, okay, and in elderly people. So in adults and elderly it is Streptococcus pneumoniae. See, there is a virus which is called as Coxsackie virus. Okay, Coxsackie virus is going to be, so it's a viral, okay, it's a viral cause of meningitis. So Coxsackie virus is going to cause meningitis especially in children. It's going to come to the children via the fecal-oral route. Usually fungi, okay, usually see so far what I have discussed here, so far I have discussed bacteria leading to the meningitis, bacterial infection leading to the meningitis, okay. But there are even fungal causes of meningitis, even fungus can cause the meningitis. Okay, in usual healthy individuals, fungus won't cause any meningitis. But in immunocompromised individuals, those immune system is working less. Okay, so in immunocompromised individuals, you can have meningitis because of even fungi. So at the end of the day, here I have given you a list. In neonates, it is E. coli, Listeria monocytogenes, as well as group A beta hemolytic streptococci. In children age groups, okay, in children and teenagers, it is Neisseria meningitidis. In adults and elderly age group, it's going to be Streptococcus pneumoniae, and Coxsackie virus is going to cause meningitis in children via the fecal-oral route, and in immunocompromised individuals, it's the fungus which is going to cause a meningitis. Okay, if someone is having meningitis, so what? So what are the clinical features that are going to be seen? So the patient is going to have a triad of symptoms. Okay, he's going to have three symptoms, triad. So what are the three things which are involved in this triad? The patient is going to have the fever first. Okay, he's going to have the fever. He's going to have headache. And he's going to have the nuchal rigidity. Okay, nuchal rigidity. So what is this? Fever, headache and nuchal rigidity. Nuchal rigidity means neck stiffness, okay, stiff neck. So neck stiffness. So these are the clinical features which are usually seen. These are the triad of symptoms, the golden triad. Next, what are the signs that are seen in a patient who is having meningitis? Signs. The patient is going to show two physical signs. Two physical signs are going to be shown. What are these two physical signs? Kernick sign First sign Kernig sign and Brudzinski sign. Brudzinski sign. So what is this Kernig sign and Brudzinski sign? Okay. Kernig sign, first let me tell you what exactly is Kernig sign. Pain in the hamstring muscles. Kernig sign is a pain in the hamstring muscles. When you try to straighten the legs, with the flexion of the hips, okay, by flexing the hips. For example, imagine the patient is lying down like this. Now he is having complete flexion at the level of hips. He is having complete flexion and he is trying to lift his legs like this, straighten the legs. Now he is going to have very much pain in the hamstrings. Now whenever he do such a posture, okay, whenever he is doing such kind of a position, now such position is going to cause stretching of the meninges. The meninges are going to be stretched, that causes the pain. Okay. So what is Kernig sign? First let me write. Kernig sign is pain in hamstrings. Okay, pain in hamstrings when trying to straighten the legs. Straighten legs with flexed hips. Okay, by flexing the hips are getting flexed and the legs are getting straightened. So immediately that is going to cause the pain. Now what is Brudzinski sign, sir? It is a passive neck flexion. Automatically the neck is getting flexed. Passive neck flexion. Resulting in the flexion of hips and knees. Okay, passive neck flexion resulting in the flexion of hips and knees. Now when you try to flex, okay, the neck, automatically hips and knees are going to be flexed and vice versa. Okay, so passive neck flexion resulting in flexion of hips and knees. So when you flex, I have said you the meninges are being stretched, so automatically the knees and hips are going to be also going to be flexed. So this is called as Brudzinski sign. So at the end of the day, the question which will be asked in your exam is, what are the two physical signs that are positive in a patient who is having meningitis? Brudzinski sign, Kernig sign. Kernig sign, pain in hamstrings. Brudzinski sign is all about the neck flexion leading to the flexion of hips and knees. Okay. Now after this, how to differentiate between the type of meningitis? Okay. Now, okay, at the end of the day, I came to know that this patient is having fever, nuchal rigidity, okay, headaches are there, positives for the Brudzinski sign as well as the Kernig sign, these are positive. Now I came to a conclusion that, okay, this patient is having meningitis. There is a chance that he can have meningitis because of bacteria. It can be because of virus or it can be because of fungus also. How to differentiate? So look here, differentiation between bacterial, viral and fungal meningitis. Okay, bacterial, viral and fungal meningitis. See, for this what you need to collect is the CSF. Collect by the spinal tap, collect the CSF. Now in the CSF, if the glucose is less, okay, glucose is going down. If the glucose is going down, which means the bacteria is using up the glucose. The amount of glucose is less than the normal. The glucose is going down. So it is seen which type of meningitis. If glucose is going down, you can narrow down the diagnosis to it's either bacterial or fungal. Why? Because both bacteria and fungus use the glucose for their survival and the division. But in viral meningitis, note, in viral meningitis, the CSF glucose levels are normal. Okay, now you can differentiate based on the glucose levels. You can differentiate between bacterial and viral, and fungal and viral. Now how to differentiate between these two, bacterial and fungal? So now how to differentiate between the bacterial and fungal? Say, if it is bacterial meningitis, okay, if it is bacterial meningitis, in CSF, you will see predominant number of, okay, you will see high number of neutrophils, okay, neutrophil predominance is going to be seen. High number of neutrophils are going to be seen. But in viral and fungal, see in viral and fungal meningitis, what you will see is lymphocyte predominance. Lymphocyte. Here also lymphocyte. So in both the conditions, you will have more number of lymphocytes. But in bacterial meningitis, you will have more number of neutrophils. How much, sir? How much? Usually the neutrophil count will be somewhere between 1000 to 2000. Okay, 1000 to 2000. But in viral, it's lymphocyte predominance. But how many number of lymphocytes, sir? Lymphocytes will be there, but less than 300 cells. Okay, less than 300 cells will be seen. But if it is fungal meningitis, less than 500. Okay, less than 500 cells will be seen. So lymphocyte predominance is going to be seen in viral and fungal meningitis. In bacterial meningitis, it is a neutrophil predominance. So what else can be different in these three meningitis? It's a protein. Okay, the proteins. Say protein, usual normal protein value. Okay, normal protein in CSF is 15 to 45 milligrams per deciliter, 100 ml. Okay, 15 to 45 milligrams per deciliter. In bacterial meningitis, how the value changes? It is more than 200, means the proteins are increasing. The protein concentration in the CSF is going to be elevated. In viral, it is less than 200. In fungal, it is again going to be more than 200. Okay. So in viral, the protein levels are going to be less. So with this, we can actually differentiate between whether it's bacterial meningitis or fungal meningitis. Okay. So in this video, what we have discussed about the different causes of meningitis, what are the different organisms causing the meningitis, and what are the clinical features of the meningitis. The patient is going to have the fever, headache and nuchal rigidity. Why fever, sir? Because of the infection. The patient is having the fever and he is having the headache because the meninges are inflamed. Okay, nuchal rigidity because the same meninges are going through the neck, okay, through the around the spinal cord. The meninges are there, they are inflamed. When you try to flex the neck, the meninges are getting stretched, that causes the pain. So neck is going to be stiff. Okay, the patient is going to be very much, he is in a fearful situation to actually bend the neck because it is stiff because of the inflammation. Okay, so what are the signs that are positive? Kernig sign and Brzezinski sign. Two signs are positive on the physical examination. Differentiation based on the glucose levels. Glucose is going to go low in bacterial and fungal meningitis, but the glucose levels are going to be constant in fungal meningitis. And what else we can differentiate is, sir, in bacterial meningitis, it is a neutrophil predominance, but in the fungal meningitis as well as the viral meningitis, it's the lymphocyte predominance. Here also in viral meningitis, see, the lymphocytes are going to be there, but less than 300, here less than 500. Okay, means more lymphocytes will be there in fungal meningitis, and by the protein also. So protein levels are going to go down. Go down in the sense, yes, in all the conditions protein levels are elevated. See, this is normal. When compared to the normal, in all the conditions are elevated, but in viral meningitis, the proteins will be less than 200 milligrams per deciliter, but in bacterial and fungal meningitis, the proteins will be more than 200 milligrams per deciliter. So with this, the important points about the meningitis which I want you to know for your exams are completed. See you in the next video. Thank you.